So it gives me great pleasure to introduce Dr. Esther van Sluijs to present the first of the invited speakers for the mid-careers, which is really exciting, on Where Next for Physical Activity Promotion in Young People. So Esther is the Program Leader at the Centre for Diet and Activity Research MRC Epidemiology Unit from the University of Cambridge. She is currently involved in evaluations of school and family-based physical activity promotion interventions and the International Children's Accelerometry Database. She holds a PhD in public health and epidemiology and has been an expert advisor on numerous panels for children's physical activity promotion, including the IOC. So without further ado, it gives me great pleasure to introduce to the stage Esther to give her invited talk. Thank you.
Thanks, Phil, for that introduction, and thanks very much for the Society for inviting me to give this talk. So in this talk, I'd like to share with you some reflections I and my team have been having over the past few years around where we are in the field of children's physical activity promotion and where we think we might be going forward based on the work we've been doing in the past few years. So first, I think there's a need to ask ourselves the question, is there actually a need for physical activity promotion in children? So are young people actually insufficiently active? So this figure shows you data from accelerometer data from nearly 50,000 children across Europe, showing the prevalence of children meeting the physical activity guidelines of at least 60 minutes of moderate to vigorous physical activity intensity per day. The countries in red is where the prevalence is over 40%, and the countries in green is where the prevalence is actually below 20%. Across Europe, the authors of this paper estimated 29% of children actually meet the physical activity guidelines. So that's actually quite worryingly low. On top of that, we know that moderate to vigorous physical activity actually declines quite steeply with age. This is data from the International Children's Accelerometry Database, of which I'm a member. And actually this shows that from early childhood, there's actually quite a steady linear decline in physical activity levels, which is estimated at about 4% per year. And we've recently shown that this decline also continues into young adulthood. So there seems to be a continued need to promote physical activity in children. But I think it's important to recognize that physical activity is not a homogeneous entity of total moderate to vigorous physical activity or energy expenditure. Physical activity is actually a behavior, and when we're trying to encourage children to change their physical activity, they are changing a behavior. And their behavior is conducted in different social and environmental contexts, and actually varies across the day, the week, and actually across the year as well. And a more thorough understanding of how physical activity behavior is actually distributed might help us understand where we might want to target our intervention efforts more effectively. So some examples of the work we've done to understand that a bit better is looking at seasonal variation. So we were able to use data from the UK Millennium Cohort study, where they measured physical activity with accelerometry in a large sample, but they actually had a subsample of individuals that were asked to wear accelerometers up to 5 times in a year. So that allowed us to assess within-child seasonal variation. So the pattern of seasonal variation you see here is quite typical for what we have in the Northern Hemisphere, with higher levels of activity in spring and summer months, as opposed to lower levels of activity in autumn and winter months. But because this was within seasonal or within child seasonal variation, we were able to look at whether actually seasonal variation differed by social demographic and temporal characteristics. And this figure here shows you the difference in seasonal variation between weekend and weekday activity. And it actually shows that weekend day activity is much more susceptible to seasonal variation than weekday activity, to the extent that weekends seem to be more active during spring and summer months, but less active in autumn and winter months. And this tells us something, that the incidental activity that these younger children engage in, because these are around the age of 7 and 8, it seems to be much more susceptible to weather conditions than the activity during the weekday. And it also points to the important role schools play to mitigate against these seasonal variations. We've also looked at how physical activity actually changes over time when children grow older. So this is data from our observational SPEEDY cohort, showing the levels of moderate to vigorous physical activity in children age 10 in the black bars and age 14 in the grey bars. And you can see here that against the backdrop of an overall decline in physical activity, this decline is actually greatest at weekends, out of school and during lunchtime, which is when children have a choice and more discretion as to how they spend their time. So for me, this and other data that we and others have produced points to a continued need to promote physical activity in young people, and particularly promoting activity in the key settings where children spend their time, such as at school and in family settings. So what do we actually know about the effectiveness of interventions in these settings? A few years ago, we looked at the evidence for physical activity promotion in the family settings, and were able to show that there was a small effect size in increases in children's physical activity. We also identified quite significant limitations, particularly around the small sample sizes and the limited reach that these interventions seem to be having. More recently, we looked at the effect of school-based interventions on accelerometry-assessed physical activity across the entire day, because we had quite a limited inclusion criteria of that the studies had to have assessed physical activity with accelerometer and have assessed it across the full day for multiple days. We were only able to include 17 studies. Across these 70 studies, we found no evidence of effect for school-based physical activity promotion. And we actually then explored whether this was similar for boys and girls and for children from different socioeconomic backgrounds, and found that across the board there was no effect of school-based physical activity promotion. So where does this leave us? Should we abandon school-based physical activity promotion, as seemed to have been suggested after the publication of the UK-based WAVES trial last year, which was also ineffective in changing physical activity and ultimately obesity? And actually that gained a lot of traction in the UK media, and there's quite a negative attitude towards physical activity promotion in schools in the UK environment at the moment. Should we focus on families, where actually there are quite significant limitations in terms of the reach that they have? The interventions are very intensive and most likely very costly as well. I think we shouldn't throw the baby out with the bathwater, but instead actually focus our limited resources on addressing some of the key issues that we see in this field. And so for the remainder of my presentation, I'd like to share with you some of the thoughts we've been having around how we might want to move forward, and provide some examples of the work we're doing at the moment. And they highlight around these three themes, and I immediately recognize that these are not the only themes that we might want to be focusing on, and there's very good work going on other aspects, but these are the things that we've predominantly focused on in the past few years. They range around the difference between our priorities when we're trying to promote physical activity and the priorities of our stakeholders and the young people that we're actually trying to change, issues around implementation of interventions, and issues around the methodological quality of the research we're doing and how we can actually move that forward. So first of all, speaking about the priorities. We know that engaging in physical activity during childhood has a range of benefits, including improved adiposity, improved mental health, bone health, and potentially positive associations with academic performance. Historically, we, and probably also the public health professionals that we work with, have focused on physical health as the main outcome of physical activity interventions, such as obesity and even later risk of diabetes and cardiovascular disease. But although these are very important reasons to improve physical activity, they may not be the reasons why our stakeholders might want to actually work with our physical activity interventions and why the young people might want to change their behaviour. And focusing on these less salient factors for them actually might impact our intervention effectiveness and ultimately the quality of the research we can be doing. So we've looked into this a little bit, and this is information from our Creative Active School Environments project, where we actually asked our interventions to rank asked our stakeholders, which included young people, to rank 9 different interventions that we had identified from previous work to implement in UK secondary schools. We were not only interested to see which intervention they thought was actually most feasible, or which they wanted us to trial, we were trying to understand how they were coming to that decision. So we gave them information for each of these interventions around the cost, the effectiveness, the feasibility, acceptability, the equality of the intervention, and the potential reach of the intervention. And we then asked them, well, which of these decision criteria was actually most important to you when you were making this decision which intervention we should pursue? And quite unanimously, they said actually it's the effectiveness of the intervention that is most important to us. But we then dug a little bit deeper, because actually we didn't just talk about effectiveness on physical activity, we actually spoke about effectiveness on a range of different outcomes, including academic achievement, the behaviour at school, mental health and well-being, but also physical activity. And we asked them effectiveness on which outcome was actually most important to you. And again, quite unanimously, effectiveness on mental health and well-being seems to be the most important factor that they chose. And physical activity was actually ranked quite low, although not as low as teacher job satisfaction, which actually scored low amongst the educational professionals as well. So this tells us something about what our stakeholders think are important reasons to actually engage in physical activity promotion and for the young people to change their behaviour. And I think we should really use this information in the development of our intervention and in the marketing of our intervention and our recruitment materials. We've done a similar exercise where we actually did focus group interviews with whole families, so getting mum, dad and all the kids together talking about why would you engage in physical activity as a family. And although issues around weight came up, there were lots of other reasons they were talking about why they wanted to engage in physical activity, like improving social skills and connecting with other people, just being outdoors and having fun, just enjoying themselves. And so I think it's really important for us to recognize that and to work with that information to improve our efforts. And we've been doing that in our family-based physical activity promotion project that we're running at the moment called Fresh, where actually this is one of our recruitment leaflets, where we're not talking about weight or physical activity. Actually, we're talking about having fun with your family and doing things together. So moving on to implementation. Now I recognize that many of you in this society are involved in implementation research, but I believe this is very much or predominantly focused on implementation of interventions that have shown effectiveness in a controlled situation and how you might disseminate that further. The thing I want to pick up on here is how much we actually focus on and understand about implementation when we're doing our more controlled evaluations. So in many studies that I have read, the intervention is actually being delivered by a researcher, in most cases a PhD student, who then holds quite tight control over what and how is being delivered in this intervention. And although this might be most efficient in a trial context, I think this approach raises issues and challenges around sustainability and the potential for future implementation. So in the Go Active trial, which is trying to promote physical activity amongst 13 to 14-year-old adolescents, we're actually trialling the real-world implementation of the Go Active intervention. And we developed a GoActive implementation strategy together with teachers and students, and it uses a tiered leadership approach, which is now being more commonly used, at least in UK secondary schools, to implement the intervention. And this is being led by a local a facilitator funded by the local council. So we very much have a hands-off approach. But this raises questions around how this actually works and whether this is being implemented. So in order to really understand what is happening and how this is happening, we've implemented an extensive mixed methods process evaluation where we use quantitative and qualitative data to really understand which of the components of the intervention are being delivered and how, where it's actually falling through, and how this may be impacting on the effectiveness of our intervention. And I believe that even if our intervention is not effective, we can still learn an enormous amount around how these interventions actually work within school settings and actually be able to improve our and others' work moving forward. So what do we know about implementation in the existing literature? So going back to the UK-based WAVES trial that I mentioned earlier, which wasn't effective, this is an extract from their table describing the intervention components that they implemented. And the top line here is what I believe is their main physical activity component. It focuses on providing daily opportunities for the children to engage in an additional 30 minutes of MVPA through classroom and playground routines. The researchers in this study actually implemented a process evaluation and identified that only 17% of the schools included in this project scored high on the fidelity of the implementation of this intervention. But actually they didn't dig a lot deeper, and so we don't know really why this is. Looking at the school-based interventions review we published recently, we also looked at how many studies actually published a process evaluation. Only 4 out of the 17 trials that we identified had a published process evaluation. And those that published one actually showed a wide variety in implementation. And I think this raises real questions around our knowledge of how interventions are being implemented within the educational system, and whether it's actually that we're looking at ineffective interventions, or whether it's the implementation of these interventions that is leading to ineffective interventions. And I think we need to do a lot more of this more detailed mixed methods research to try and disentangle what it actually is that's going wrong with our interventions. So lastly, I want to talk about the importance of methodological rigor and how we are working to address some of the methodological limitations I see in the field. So a few years ago, I published this paper with Susie Krimler discussing some of the key issues we had identified from our own experiences in this field, attempting to highlight how and why rigor across the entire intervention research process actually matters. And we really try to highlight how we need to consider why and how we make decisions throughout the research process, why that matters for the conclusions that we draw, but then also to be really honest and transparent in our publications around why we did certain things and how that might have impacted the conclusions that we're drawing from our work. So how are we challenging ourselves to do the best research we can? Well, this is the research approach we take to do our behaviour change research. And we actually, we combine observational evidence and evidence syntheses, as I showed you before, with input from our stakeholders to identify and then develop interventions. And we subsequently go through a structured but also very iterative process of intervention development, early testing, and leading to a full trial and potentially future implementation. A key point here is that actually information generated throughout this research process should be fed back to earlier phases, either identifying new intervention strategies or new ways for new qualitative or observational research. And actually, I think all of that should be shared with the wider community as well, so we could all be improving the quality and relevance of the work we're doing. So an example of where this has led to is the evaluation of our Go Active trial, trying to promote physical activity in adolescence, where we've gone through a transparent but very extensive development and early testing process, leading to the evaluation of the intervention in a full trial, which we're actually completing at the moment, where we recruited nearly 3,000 13 to 14-year-olds. I think it's important to also recognize that this is not a nice linear process as it's described here, and actually that at each of these stages you might want to decide and hold or actually stop with a certain strategy. So an example here is the intervention that we finally selected within the case project that I mentioned earlier, where our stakeholders unanimously suggested that actually what we should try is introduce physically active lessons into secondary schools. We then conducted extensive mixed methods feasibility and pilot studies to really understand the acceptability and the feasibility of this intervention approach, and try and untangle some of the uncertainties we had around the intervention design. Based on all of this data we collected, actually we concluded that at this point in the research, it is actually probably not the best idea to move forward with this for a full trial. But we collected enough information to know how we might go about actually adapting the teacher training that was part of this intervention to then hopefully improve the effectiveness later on. We're also challenging ourselves to apply a similar amount of rigor to our work outside of the school setting. And an example of this is the FRESH intervention, Families Reporting Every Step to Health, which is actually based on the family-based review and the focus groups that I described earlier. Here we're using self-monitoring and goal setting to encourage entire families to become more active together. Families can use a web-based system to virtually travel across the world and choose destinations. But the key element is that actually families have shared goals. They're not individual goals. It's about how many steps are you going to take as a family this week. So here we're in the earlier stages of the research process. We've conducted and published a feasibility study, and we're in the process of finishing off a pilot study, trying to address key uncertainties around intervention delivery and the acceptability of this type of intervention, but also issues around recruitment, which is a known challenge in family-based research, and study design. And so I think there's a need for a concerted effort, not just around school-based interventions, but also out of school settings, to really understand how we can most effectively engage children and their families out of school. So just finishing off, as I said before, these are only some of the ways that I think we can move the field forward, and I'm more than happy to have discussions about what you're doing and how you think we can do this. But I think the key thing is that we should carefully learn from all of the research that we've done and from the research that we're doing at the moment to really try and gain as much learning as we can from the interventions. So we're not just dismissing one intervention because it was ineffective and then moving on to the next, because there's generalizable learning from all of the studies that we're conducting. And I think we need to remember that in this complex problem, there's no silver bullet. It's not about promoting physical activity in schools. It's not about family-based physical activity promotion or introducing structural changes. It all needs to come together in order to tackle this problem of physical inactivity in children. So lastly, I'd like to acknowledge my funders and acknowledge my team, past and present, for their contributions to the work I've been able to present here. Thank you very much.
Thanks to Esther for a very insightful and excellent presentation. We do have a few minutes for some questions, so if anyone would like a question, I'd ask if you could just go to the side to one of the microphones. I'll give you a few seconds to move, but while they're moving there for the questions, I'll start with one. So, do you think our best bang for buck would be targeting schools or families for physical activity promotion, and why?
You know, my answer is going to be we need to actually tackle everything, and I don't think there is, in that respect, there is a biggest bang for the buck. I think there's only so much we can do within the school setting, and we can change, for example, the environment in the school setting and encourage children to be more active within the school setting. But actually, how much that translates to physical activity outside of the school and at weekends, I think is questionable, and I don't think we actually know enough about that. And if children after school move into quite an unsupportive environment for physical activity, all our school-based efforts go to waste. So I think actually we should invest our resources in trying to figure out how we can combine different types of approaches that work for different types of people to improve overall physical activity. So I know that may not be the answer you wanted. But.
Hi, thanks so much, Esther, for a truly lovely presentation. I'm Heather McKay from the University of British Columbia in Canada. And I saw that on your continuum that scale up and discussions of scale up, it was introduced in the seventh sort of iteration of your trial. And I see that planning for implementation in the first instance is one process, and planning for scale up is another. Could you just tell us about how you think schools and stakeholder groups can plan for scale up, and how that it may be a different planning than what you've presented?
Yes, so I don't think we know the answer to that question. So we're actually embarking on a body of research where, for example, we're going to do ethnographic research in schools, where we're going to try and figure out actually how does the school environment actually work, and how can we embed within that. From experience, if you look at the process evaluations that have been conducted, it's usually dependent on just one individual just being very enthusiastic and driving the physical activity promotion or the intervention forward. Once that person leaves, it all drops down again. So I think it's partly to do with actually quite higher level management, getting them on board that physical activity or obesity prevention or healthy eating, whatever your goal is important, that we have shared goals, because actually asking schools to spend time on physical activity and on healthy eating where actually that's not part of their goals, that's not what they're assessed on, I think might be quite unfair, and I think that's also evidence that we're seeing from the schools. So senior leadership shared goals, and for instance in a system like the UK where the overarching body of inspection is called Ofsted, and where actually that schools do everything to get a good Ofsted rating, actually getting much more higher level buy-in that is important. That's changing in the UK setting, but I think it remains to be seen. So they're talking about that they might include that in an inspection, but how much weight that's going to carry, I think, is quite questionable. So I don't know whether that answered your question, but those are my reflections.
Thanks, Esther.
Okay, in the interest of time, we do have another invited talk. We might just hold any other questions till after. Esther will be around, so please join me in thanking Esther again for a wonderful presentation. And I'll call up Leslie to introduce our next speaker. Thank you.